Okay, good, I guess, afternoon, everyone. It is 12 o'clock. I think we have a pretty good crowd, so I am going to get started. Thank you for joining me today. As you may remember, Brittany is off today, so I am going to be hosting you today. My name is Sarah Gill. And before we get started, I would just like to remind everyone that this is Rosanna's last media scrum, so try and go easy on her. And let us start with the land acknowledgement. So we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. To begin, we're going to have our board chair, Mayor Andy Mitchell, to start us off with some opening remarks.
Thank you, Sarah. As the Delta variant continues to spread and new modeling indicates an increasing number of cases will emerge in Ontario, the battle against COVID-19 continues to evolve. The key to our success does not rest with any one approach. Nothing is 100% effective, but with a combination of approaches. There is no magic bullet, but rather our defense comes from a multitude of protective layers that together work to protect us. Our first line of defense, as always, is practicing good public health measures. Wearing a mask indoors where required. Keeping a physical distance of 2 meters when masking is not possible. Washing your hands thoroughly and regularly, and not assembling in large groups. Our second line of defense is staying home when you are ill and getting tested. The less people you are in contact with if you do contract COVID, the less the disease will spread. Testing remains available at PRHC, and if identified as a close contact, please follow the advice of Peterborough Public Health. The third line, and the most effective defense, is getting vaccinated. People who have received 2 doses are significantly less likely to be infected and have less severe symptoms than those who are not. Please, if you haven't already and you are eligible, get immunized. The fourth defense is to continue to do all 3 of the first 3 steps. As good as vaccines are, they are most effective if people continue to practice appropriate public health measures and to isolate and get tested if they experience symptoms. In closing, I too would like to recognize that today will be Dr. Salvatierra's final COVID briefing as Peterborough's Medical Officer of Health. These sessions have provided the media, and through them, our community, the information needed to stay safe and to effectively combat this pandemic. Dr. Salvatierra, your dedication to the people of the Peterborough region has made a huge and positive difference and helped keep our community safer. Thank you. Stay safe, be well, and in all things, be kind. Thank you very much.
Thank you so much, Mayor Mitchell, for that really important reminder about the COVID safety guidelines. And we are going to move on to Dr. Salvatierra to provide our situational update.
Thank you, Sarah, and thank you so much, Mayor Mitchell, for your very kind words. So let's look and see how we're doing in Peterborough today. We'll bring the dashboard up. There you go. Thanks, Sarah. We have currently 36 active cases, and we are following 179 close contacts. These numbers are tracking significantly higher than 2 weeks ago, as they are across the whole province. The Delta variant continues to be the dominant strain we are seeing here in Peterborough. Next slide, please. We're showing you here the new cases. Oh, thanks. The new cases report. Oh. Okay, let's see if we can keep this slide there long enough for me to finish my sentence. So we're showing you the cases by week, and you can see down the side of the figure that we are seeing an increase week by week for the past 4 weeks. Provincially and nationally, it does appear that we are at the beginning of the 4th wave, and you can see that in the figure here as well. Next slide, please. On this slide, we are showing you, I'm getting some feedback. So I'm going to ask everyone if you could please put yourself, just check to make sure you're on mute. And then if you're not, if you could just please put yourself on mute. So here we are showing you our case data from the last 2 weeks. And you can see that young people continue, and these are young people under the age of 30. It's all relative, I suppose. But they continue to represent the largest proportion of our cases in our area. And this is a trend that we have noticed throughout the pandemic in our region and across the province. Next slide, please, Sarah. I'm pleased to report that we continue to have no outbreaks. Let me just flip this over here. Sorry, there we go. No outbreaks in our community. But as you may know, we do have a local restaurant with several cases in their staff that did lead to us issuing some guidance through the media. So given the large number of patrons that were potentially impacted. So thank you for your help in that. Technically, it does not meet the criteria for a workplace outbreak just yet, because we believe that all staff acquired COVID at a private gathering outside of the workplace and then took it to work. However, we have recommended that anyone who dined in the restaurant, and that's the Canoe and Paddle in Lakefield, between August 30th and September 3rd be tested, and we continue to follow up both cases and contacts. Next slide, please. So here we're showing you a map, and it's giving you our weekly case incidence rate as it compares to the rest of the province. You'll see on the right hand of the slide that for the period ending September 4th, our weekly incidence rate has increased considerably from 9.5 2 weeks ago to 18.2 cases per 100,000. We give you also the provincial rate, now at 34.8 cases per 100,000, which is also seeing an increase. This map is showing you the case incidence rates over the past 14 days in each region of the province, and we have moved from green to yellow. Next slide, please, Sarah. As you can see, when we compare the incidence rates for the regions across the province from August 26th to those rates reported on September the 7th, you can see that incidence rates are increasing across many different public health units, particularly in the Southwest and in the GTA. Next, we'll show you our wastewater surveillance, where we are doing both at the Millbrook in blue and Peterborough in red at the wastewater treatment sites. And we continue to see evidence of coronavirus at both of these testing sites. This aligns with the geographic location of our most recent active cases. And here, when we show you the data from August 9th to September 2nd. You can see if you look at the green line, which indicates our active cases, you can see that usually we observe positive results in wastewater first, and then that corresponds with an increase in cases. So it continues to give us a bit of an early warning system, and right now is showing that we can expect to see ongoing cases emerge in our human testing. Okay, let's move to some good news. And this is our most recent vaccination data at the end of yesterday's clinics. So starting with our youth rates on the left, you can see that almost 80% of our youth aged 12 to 17 have received a first dose, and more than 65, almost 66% of our youth have received 2 doses of the vaccine. Anecdotally, we are very pleased to report that our vaccine clinics at local schools have been well attended by students, by their guardians and parents, as well as by community members. So I hope to see these rates continue to climb so that we can ensure schools are able to remain open with as few disruptions as possible this year. The middle chart is showing you the proportion of eligible residents, and that's anyone 12 years of age and over. And you can see that we are well on the way to having at least the 85% of our eligible residents receiving at least 1 dose, and very close to 80% of our eligible residents with 2 doses. So we have a little ways to go, but we're getting closer to that. So congratulations, Peterborough. It's impressive news. If I could have the next slide, please. Here we are showing you a bar graph of our rates by age of residents. And you can see purple the first dose and green second. You can remember a few weeks ago, we had seen a dip in the proportion of young residents who were getting vaccinated, specifically those in the 20 to 40 year age ranges. However, I'm pleased to report that these rates do appear to be climbing. And we are seeing many of these young adults in our clinics. So thank you so much for coming forward and getting immunized. On the next slide, we are showing you our vaccination rates for the community as a whole, and that does include young children who can't be immunized. So last week, our rates did increase slightly to 72%. Of those who've had 1 dose. I see here we're showing 73.4% as of yesterday, and almost 68% as of yesterday for second doses. The map of September the 9th is allowing us to compare our vaccination rates with those of the rest of the province. Nice to see many of us over that 60%, and certainly we are hoping to reach blue as soon as possible. Just a reminder that the province has increased its goal to 90%, and in order to reach that, we will have to immunize more than 10,000 additional Peterborough residents with both a first and second dose. Okay, let's move on to the next slide. This is data that we have shared previously, but it has been updated and this is data from the Ontario Science Centre, which shows us the benefits of immunization. So of course, the risk from COVID has increased because of the Delta variant, but you can see how much immunization helps. So the unvaccinated individuals are currently 6 times more likely to get infected with COVID. They are 30 times more likely to end up in hospital, and they are 48 times more likely to be a patient in an intensive care unit compared with people who are immunized. Thanks, Sarah, for that. We'll now also include, I just wanted to touch on some of the modeling data that was released by the Ontario Science Table on September 1st. They looked at modeling done by 5 different Ontario universities and came up with this consensus modeling, which does give us some prediction as to what a 4th wave in Ontario will look like. The modeling shows us the best case scenario in green and the worst case scenario in orange. The reality will be somewhere between that. So if all residents continue to follow our public health measures by reducing their contacts, and we are able to accelerate our uptake of vaccine to reach 85% of eligible Ontarians, we could look forward to the green line, which is showing really a blunting of that 4th wave, really an elimination of that 4th wave, keeping people safe and reducing hospitalization. However, the orange line does give us a much more grave prognosis with if we were to see a 25% increase in infections and a relaxation of our public health measures, then we could see a very large wave of cases, potentially higher than what we experienced in the 3rd wave, with the possibility of overwhelming our hospital and ICU capacity. So this modeling can serve as an encouragement to continue our local efforts to provide easy and convenient vaccines. I will put a plug in here for all of our pharmacies who are offering either Moderna or Pfizer vaccines. And I will also emphasize that we do need to see those younger adults who make up the greatest proportion of our cases step forward and get immunized as soon as possible. As our board chair has so aptly urged us today, we need to do our best to limit our contacts and to continue to follow public health measures like masking and distancing in order to keep our community spread low this fall. So that's an end to the slides, and I'll make a few remarks. This is my final media briefing on the COVID pandemic. It's been a privilege for me to serve as your medical officer of health, particularly in these last 20 months as we have fought this pandemic together. In 2 weeks' time, Donna Cherokee, our Director of Public Health Programs, will step into my shoes as our Incident Commander, and she will be joined by our Acting Medical Officer of Health, Dr. Ian Gemmell, to lead you through these media briefings. Dr. Thomas Pigott will start in December. And before I leave, I wish to express my thanks to all of our media partners for the impressive job that you have done in following this pandemic and in helping to tell the local story. You have been reliable and welcomed partners. So it is clear to see that Peterborough is now experiencing a 4th wave, thanks to the presence in our community of the Delta variant, which is twice as transmissible and 2 to 3 times more likely to cause severe illness, requiring either a hospital or ICU admission. Modeling projections shared by the Ontario Science Table show that unless we can increase our immunization to at least 85% of all eligible Ontarians aged 12 years and over, and at the same time continue to implement public health measures in order to reduce our contacts, we will be heading into a wave that could be big enough to overwhelm our provincial ICU capacity. I really don't think that any of us want to go there. And so I am calling on everyone in the community to help keep each other safe and COVID-free as we face yet one more period of increased risk this fall. Schools have reopened, and I would like to see them stay open. But the safest way to do that is to ensure that everyone in the classroom who is eligible for immunization gets their second dose as soon as possible. To that end, I urge families with vaccine eligible students to visit one of our school clinics being held throughout the city and the county, or to call their local pharmacy and make an appointment for a vaccine. There remain many ways to get your vaccine here in Peterborough, and we are committed to making it as easy as possible. If a class or a school bus cohort is dismissed because of a COVID case, please note that all those in the cohort who are fully immunized will be able to return to the class or the school bus, potentially without any interruption. Unimmunized students will have to remain home to isolate for 10 days. If you are fully immunized, you can continue to work or attend school, even if a member of your household is ill and is awaiting COVID test results, as long as you remain symptom-free. And if a household contact develops COVID, as long as you test negative and remain symptom-free, you will not lose any time away from work or school if you are fully immunized. These are just some of the advantages of being fully immunized, and come September 22nd, there will be more. Today, I issued a letter to all Peterborough employers urging them to introduce workplace immunization policies that would require their staff to be immunized against COVID-19. And we've provided them with lots of resources as well as a toolkit to assist. Immunization is the most powerful way to keep workplaces safe for all who enter. The provincial vaccine passports will eventually make it much more convenient and even easy to voluntarily share one's vaccine status. But in the meantime, anyone who's been immunized in Ontario can print a record of their vaccine history or save it as a PDF on their smartphone. Yesterday, Peterborough Public Health approved a new COVID-19 vaccination policy for our own employees, and I'm counting on others to follow the leads of Fleming College, of Trent University, of our school boards, our hospital, our family health teams, our long-term care and retirement homes, and the many other workplaces who are eager to reduce the risk of infection for their staff, for their patients, their students, and clients. We will be sharing more information about the vaccine certification announced by the province last week as we get the details. We don't have them just yet. But in the meantime, I hope everyone will see these measures as both a positive and a proactive way to help keep us safe during this fourth wave. They aren't a forever tool, but they are a temporary measure that works in two ways. It helps keep higher risk venues and activities open despite higher case counts. And they also act as an incentive for all of us to complete our immunization in order to ensure that we can continue to do the things we enjoy, like dining out at a restaurant or going to the cinema. I'm going to stop here for now, and I'll hand it back over to you, Sarah. Thank you.
Thank you so much, Dr. Salvatera. So moving on to our elected officials, I believe Mayor Tarian is on the call. Do you have any remarks you'd like to share today?
Thanks, Sarah. Just a few quick ones if you can hear me.
Mm-hmm.
Perfect. So just wanted to highlight that the city continues to work with our partners to monitor the situation here locally and developing best practices in line with provincial guidelines. And with school back in session and people out in the community for that and other reasons, we're asking people to continue using kindness and common sense to help keep our cases as low as possible. And then I would just reiterate the points made by Chair Mitchell and Dr. Salvatera about avoiding large gatherings and staying home if you feel unwell, and most importantly, getting vaccinated. I would also just like to extend a huge amount of admiration and gratitude to Dr. Salvatera for all of her work for our community over the years. I've had the pleasure of working with her since about 2013 when I was with the Poverty Reduction Network. And I've been consistently blown away by her intelligence, her passion, her dedication, and her integrity. So, Dr. Salvatera, on behalf of myself and City Council, the city and residents of Peterborough, I just wanted to thank you for all the work that you've done on this file and the multitude of other files that people don't necessarily see because they haven't been quite so public as this pandemic. So I'll just leave it there for now and I'll be on for questions. Thank you.
Thank you so much, Mayor Tarian. So moving on to our media and questions from the media. Now, I am not as proficient as Brittany at remembering all of the names of our fantastic media. So if you could please just put your hand up if you have any questions for Dr. Salvatera or anyone else on the call, and I will be happy to answer your questions. Awesome. Matt, you are first.
That just means I can click faster than everyone else. Can you hear me? I just want to make sure first.
Yep.
Awesome. So my question today is for Dr. Salvatera. First and foremost, congratulations on the position with Alberta Health. But I thought you were retiring. What happened here? Is this something that was kind of like a bucket list item for you?
No, Matt, I just have a hard time saying no. And I'm going to be there anyway, so it's an opportunity for me to help out. I will, and to slow down. I'm hoping, fingers crossed. I've agreed to a 4-day work week, which gives me more time with my grandchildren, and I won't be on call every day as I have been here in Peterborough. So that's something to look forward to as well. So it's a change of pace, as well as a change of a whole different public health act, different legislation, different healthcare systems. So I'm looking forward to learning more and experiencing public health from a different perspective.
Perfect. And my next question had to do, I guess, more about the fourth wave here in Ontario. It feels like we've been hearing for a few weeks now that the fourth wave is coming. At this point, do you feel like it's kind of inevitable that it is going to happen and you just have to try to, I guess, minimize it as much as possible?
It's here. It's here. And if you ask any of our staff here at Peterborough Public Health, especially those who've been working on the weekends, we're busy again. And you saw the number of high-risk contacts that we're following. So we're certainly feeling the surge, and we've prepared for that. We're staffing up again on our COVID response while we continue to support the vaccination as well as the reopening of schools, as well as all of our business partners who are doing their best to keep their staff and patrons safe. So it's busy again. Yes, we're definitely in the surge.
With so many people locally being fully vaccinated, is there a concern that maybe they won't take a fourth wave as seriously because they are fully vaccinated?
Well, I think that's human nature, and we saw that happening as soon as people got their first dose. We saw some people easing up on their other public health measures, and so we certainly can't let that happen. We need to keep our guard up. I mean, fortunately for those who are immunized, they can expect it is a lower risk of infection, and if they do get ill, they tend not to be as ill. Many of them are asymptomatic and caught and are identified on just by testing. So that's good news. The vaccines are working. However, you know, people who are immunized also can carry the virus in their nose and can shed it. And the Delta, there's a lot more viral particles that are shed if it's Delta. So you can actually infect others. So we still need to keep up our guards, as Mayor Mitchell reminded us, keep masking, keep our distance, and reduce the numbers of contacts so that we aren't exposing ourselves to greater risk.
Perfect, Dr. Salvatierra. Thank you, and best of luck with everything.
Thank you.
Thank you so much, Matt. Moving on to Paul Rellinger.
Hi, Dr. Salvatierra, and let me also offer my congratulations as well on your new role, and for being the holder of the shortest retirement in history. So it's pretty amazing. I had a couple questions. Of the new cases, are you can you offer any sense of how many of those are vaccinated or unvaccinated? Are the not an exact number? If you had that, that's great. But are the majority unvaccinated?
Yes, Paul, I can tell you with all confidence that the majority of our new cases are not immunized. And you can see by the ages that we also have many in younger children who can't be immunized yet. We will be able to give you that data. I know it's a little time consuming for us to collect it because we have to go through the records manually to pull it, but we will have that for the media because I know that continues to be something of interest and I think of relevance locally as well. Certainly, the province continues to share that data on larger numbers, and you will see that there as well, that the vast majority of new cases are in people who are not fully immunized.
Okay, thank you for that. And regarding the vaccine passport, since that was announced, and I know you were a big proponent of those, especially being announced at a provincial or federal level. Have you seen a discernible uptake or uptick in the number of people getting vaccinated since the passports were announced?
Well, we've seen an increase in people coming forward, Paul, here in Peterborough. I mean, we've had to actually schedule an additional pop-up clinic at the Healthy Planet Arena to accommodate the numbers. And we've certainly been very pleasantly surprised at the numbers we're getting at the school clinics that have been held. I'm not sure if it's because school's starting and people who, you know, put things off till September are now getting their final dose, or whether it's the provincial announcement last week. Certainly, we have seen in other jurisdictions that announced passports or vaccine certification that it did create an incentive. And we are seeing that more people coming forward for first doses, which is very, very encouraging to us. So the numbers are going up for both first and second doses. I do think that the certification is making a difference, as is the introduction of workplace immunization policies in places like schools, our college, our university, and elsewhere, and as is the return to school, where suddenly, you know, kids are back in the classroom and those vaccines make a lot of sense.
Great, thank you. Just a couple more things very quickly. We talked, I think, a couple weeks ago about the possibility of booster shots in long-term homes and long-term care homes and retirement homes. Can you give us an update on that? Is that happening, or where are things at?
Yes, it is happening. And I would believe that this month we will see those third doses being provided in those long-term care home facilities. So it's not all retirement homes, it's long-term care homes and high-risk retirement homes. And a high-risk retirement home is one that has a memory unit or is co-located with a long-term care facility. All of those facilities here in Peterborough will be offering immunization. Most of them will be doing it on their own with their own staff. So again, just a shout out to our wonderful partners in the community that are working with us to ensure that their vulnerable clients and residents are protected.
Thank you. And just one more thing regarding the canoe and paddle. Do we have a number? Is there a number of cases that have evolved from that situation that we know of?
I believe I think at our latest count, Paul, we were still at the 4 staff cases.
Okay.
And I'm not aware that we've received any positive cases in those have been tested, but I'm going to turn to Sarah because I know, Sarah, you asked for an update this morning. Is that the case?
Yes, that's correct. There haven't been any cases identified otherwise.
Great.
So sorry, just to clarify, basically just the 4 staff cases at this point.
Yes, so far, yes.
Okay. Again, I wish you well, Wes, Dr. Salvatore, and thank you for all you've done. I would not speak on behalf of all the media, but I know you've been a great help to me and much appreciated over the years.
Well, thank you, Paul. It's mutual. I really enjoyed working with all of you.
Thank you, Paul. So moving on to Jessica.
Thanks, Sarah. Hi, Dr. Salvatore. I will be the third to congratulate you. I don't know how you have it in you, but good for you. You just can't slow down. Is this the last time we'll see you?
This is my last media briefing, but never say never, right, Jessica? Who knows what'll happen between now and September 19th? So if there's something that requires a media briefing, or if there are interviews that need to be done, I'm still working.
Okay, so you're on till September 19th.
Yes.
Okay, so we can come and you can wave to us outside the window if we're not ready to say goodbye just yet.
Okay.
Okay, so I have my colleague Megan here today who has a sports question. I'm going to have her ask so that I don't mix it up, and then I'll come back and talk about vaccines. So here's Megan.
Hello.
Hi, Megan.
Hi. I was speaking with Peterborough Minor Hockey, and they are just looking for clarification on the expectations of players being vaccinated and wondering, do they have to be vaccinated by September 22nd, the players who are eligible?
Well, I'm going to see whether Julie Ingram may have an answer for you, Megan, since she's been our frontline person with on that file. Julie, do you have an answer for Megan?
Hi, Megan, and I wish I did have a solid answer, but my answer at this point is that we are waiting further information from the Ministry of Health on this. We are expecting a instruction to come down from the Chief Medical Officer of Health regarding vaccine passports and how those will be rolled out, including for the sport and recreation sector. So I do not have a firm answer on that with respect to dates. We are expecting the 22nd that will be implemented by, and it will have to be shown, but I can't say that affirmatively until we get the guidance. What I'm going to add to that is that we too have been in heavy communications with Ontario Minor Hockey and other sporting sectors, and I respect the challenges that they are facing, all sporting sectors are facing right now, going back into sport and recreation, which is so important for so many different reasons. And I'm so glad to see sports and rec happening again. But I'm pleading for a little bit of patience, because when we know more, you'll know more. We've got lots of distribution lists that we're communicating with, and like we've all said before, we're all trying to get through this together. So I'm hopeful that next week we will have more information that we'll be able to share then. Thanks.
Okay. Is it, Julie, can I ask you one more question, a follow-up on that about, they were just mentioning that they need 40 players on the ice to operate properly. But right now, I think the health unit has it capped at 30. Will that change at all here in Peterborough?
Yeah, that's a great question. So we've been going around this 30 and 40 cap recently, and I just want to make it clear that Peterborough Public Health works very closely with our sport and rec facilities. We're meeting with recreation managers monthly to talk about the logistics of complying with public health measures at their facilities. So when we think about capacities, we have to remember that there's different aspects of where those capacities might apply. So for instance, for most of our local facilities, change rooms are what I like to call the pinch point, where you don't necessarily have to maintain the physical distancing when you're engaged in sport. So for instance, when you're on the ice, you do have to maintain the physical distancing in change rooms. So if there's limited change room facility, therefore limited capacity, that's the pinch point, and that's the driving factor for how many people can actually be accommodated on ice. So that 30 actually came from the majority of our local sport and recreational facilities who said that was the number of people that they could accommodate in their change rooms. We also had a lot of our sport and recreational facilities work with each other to keep a consistent Peterborough approach. So I understand the operational needs for the 40, and never have we objected to that, but it's the facilities that have to be able to accommodate that. And like I said, we're working with those facilities to see if that's a possibility.
Okay, thank you.
You're welcome.
Thanks, Julie. I'll go back to Dr. Salvatierra. I knew you'd be on the call, Julie, and you'd probably be the one to answer the question, so I invited Megan in. Okay. Dr. Salvatierra, I want to talk more about the workplace recommendation. I know it's all lined out in the media release, but I kind of need you to talk about it for TV. So what is it, in a few words, what would you say you're looking for? What are you asking employers to do?
Well, I mean, I think what we have spelled out in our letter, and Julie again might be able to elaborate if you have additional questions, is we're encouraging employers to introduce a workplace COVID-19 immunization policy. And it's really up to the employer as to how far they want to go with that policy. But we are recommending that COVID-19 vaccination be required by all staff, and that there needs to be some way for the employer to validate that the 2 immunizations have been actually received. So, and that, because that is personal health information, the employer needs to have, make sure that they do comply with all of our privacy legislation in collecting that information and in storing it, and also making sure that it's only used for the purposes of implementing this policy. I think it's up to the employers to also decide whether or not they want to do anything above and beyond that, like, for example, introduce rapid testing for employees who are unimmunized. But we've really left that open for them to just make that decision on their own. We've also asked them to ensure that they continue to insist on strict adherence to public health measures like physical distancing and masking in the workplace, that they ensure that where appropriate or where needed, that personal protective equipment be worn, and also to ensure that they have that proper ventilation for their staff. So those are the components that we've outlined in the letter, and we've provided them with lots of links to resources, and as I said earlier, provided them with a toolkit, an online toolkit to support that work as well.
Thank you. And just 2 more on that. Is it for every workplace, or do you recommend it for like every workplace? What if it's a small workplace of 3 people? Should someone still have it?
I think every workplace can benefit from having a workplace immunization policy. It really doesn't matter on size. Size doesn't matter, Jessica. It really is an effort to keep workplaces as safe as possible. We continue to see outbreaks linked to workplace exposures, but also because workplaces are often public places where the public come. And so again, in order to make those places as safe as possible for members of the public, it's important to have a workplace policy.
Okay, and you've often been ahead of the province in making decisions like this. Do you see it being something that the province might, I know it's the crystal ball question, do you think this is something that might be implemented down the road?
Well, we've seen that already start. I mean, I think our Chief Medical Officer of Health has made it very clear that he is working his way down a list through really by priority. So, we already did long-term care workplaces were already done back at the beginning of July, but our current Chief Medical Officer of Health issued a directive to all healthcare settings like hospitals. He also then mandated that colleges and universities implement these policies. We've seen the Ministry of Education require school boards to implement these policies. So it may just be a matter of time that this is definitely the trend. And at this point, my letter is really just a letter of encouragement, recommending to our local workplaces, depending on what happens with this fourth wave, that could be escalated to instructions. And I know that many of my colleagues across the province are considering issuing, many have issued letters like mine, others are considering going a little further and actually issuing letters of instruction under the Reopening Ontario Act, which then become enforceable.
Okay. And then my last question is about restaurants and the vaccine passport. I have been hearing that some restaurants say they don't have the manpower to be checking it. They don't want to, they might not want to turn away the money, and they don't want to deal with aggressive customers. So, what do you have to say to them? And will there be a penalty? I guess they would be penalized if they didn't check.
Yeah, I think those are all valid concerns. And I think it's just a little premature to be making decisions, because we really do need to wait to see how the province is going to operationalize this and what the regulations will look like and where that onus is going to fall. So, and also additional what tools and resources and supports that the province will have to offer. So I'm going to ask our local restaurants just to hang in there for a little longer. Once we get the regulations, we will be communicating with them and we will be providing all of our support. These are will be regulations, so they will be enforceable. And again, it'll be up to the province to decide how best that will be done and who will be enforcing. And so there will be a penalty for those who don't comply. And there may be some that if they're not willing to comply, maybe restricting their restaurant to takeout only.
Okay, that's it for me, Dr. Salvatera. I am still a little sad this might be the last time I see you. We've all gotten so close over the internet over the last year. So best of luck if I don't see you, and you will be missed.
Thank you, Jessica.
Thank you so much, Jessica. Moving on to Joelle Kovac.
Okay, I'd like to start with a question for the mayor. And my question is, what is the city's policy for vaccination, both for city employees and for city council, please?
Yeah, thanks, Joelle. So we are, staff are currently working on a draft policy for employee vaccination. So that is, as I said, in the works. We're looking at what other municipalities are doing, as well as looking to the province for guidelines on that. So that has been discussed at our emergency control group and will be coming to council later this month. But it's still in draft process, in draft format.
Does that apply to city council as well?
Yeah, well, it applies to employees of the city. So that includes council.
Is that going to have some bearing on when council can resume meeting in person or not? Perhaps not safe yet.
I mean, I think we were looking to not probably meet in person until November anyways. So whether or not the policy explicitly speaks to that, I'd have to check.
Okay, that's good. I have one for Dr. Salvatierra as well, please. Dr. Salvatierra, did you say that there remains about 10,000 people in Peterborough that are still eligible for a vaccine?
Yes, I did, Joelle. It's actually a little more than 10,000. It's about 10,500 that we would have to immunize in order to get to that 90% level. That's what I was referring to. And, you know, I don't think that that's going to be done quickly. I think that that's something we can see, we will probably see happen more gradually over time.
Okay, thank you. That's about all I have today.
Okay.
Fantastic. Thank you, Joelle. Have I missed any of our media partners? I don't see any additional hands. Okay, great. Well, thank you all for joining us today, and I am going to echo everything that everyone has said on this meeting. We are going to significantly miss you, Dr. Salvatierra. You have been a fantastic leader and have done some amazing work, and we wish you the best on your new adventure. Alberta is extremely lucky to have you. So thank you so much.
Thank you.
Thanks, everybody. Bye, Dr. Salvatierra.